to agitate the skin and see if there are any signs of excess flaking or any areas of concern. I do tend to hold dirt or dust or dead skin cells here in this small corner of the ear. Hi Samantha, it's time to go ahead and begin with your examination today. So I have you scheduled for a bit of an in-depth inspection of your skin, specifically placing emphasis on the hairline area surrounding the eyebrows and eyelashes. And then I want to have a look at the external ear, see if there's anything that I think could be of concern there. So just overall performing a good once over. I'll have a bit of a look inside the scalp, placing an emphasis on any signs of infestation, lice, mites, ticks, or otherwise. So just going to be having a pretty thorough look here. So you're welcome to just relax, lie in a position that's comfortable for you. And then of course let me know if anything should cause you any discomfort at any point, okay? Okay, alright. So let's go ahead and get started. So to start off, I typically like to perform a visual inspection, and that's just going to consist of me using my pen light to shine at different areas of your skin and just have a bit of a closer look. So you are welcome to either close your eyes or leave them open, whatever is more comfortable for you. I will say the light is fairly bright, so it might be in your best interest to keep them closed. So just let me know if at any point I cause you any pain or you feel any tenderness. Starting by performing an inspection of your hairline, I'm just going to follow along the path of the hair that surrounds your forehead, shining my light directly along the follicular line, visualizing any areas of concern. So far looking for any thinning, any signs of alopecia, hair loss, any pulling at the follicle. I like to place emphasis on the temporal region, as that's where I tend to see areas of traction loss, but so far that's not notable. So coming down onto the forehead, again having a look at the skin. As I come down towards the eyebrow and the brow bone, shining my light directly above the brow bone, checking bilaterally for any signs of edema, inflammation, swelling, any pockets of fluid or areas of irritation. Having a look at the brow itself, so now the hair of the eyebrow, very well groomed, nice and clean. Overall appearance is well kept. Coming down towards the eyelid, looking at the overall texture of the eyelid and eyelashes. Very smooth in texture, not noting any abnormal lumping or bumping, no rigidity as far as I can tell. Shining my light directly over the lashes, I do see several phases of growth. Indicates some new growth at the lash line. If I come down below the eyes, having a look at the orbital socket and bone just beneath your eye. So I'm just going to turn your head here slightly, Samantha. That's perfect. And again, having a look at the overall health of the brow. Looking for fullness. I will have a closer look at the eyebrows and eyelashes using my Otoscope tool, which is just a magnified lighted tool that allows me to have a bit of a closer look. And as I shine my light the center of the forehead, I can see that there is symmetry along the line of the nose. Again, just visualizing at the hairline. So just gonna have a look at the ear externally, look for any signs of debris. This side looks okay. You do have 2 active piercings. They appear to have healed nicely. No signs of any flaking or discoloration here. No excess dry skin or cerumen protruding externally from the ear canal. And if I have a look at the other side, again I see 2 piercings. Appear to have healed well. I do see just a little bit of dead skin there around the lower first piercing. And mild dryness of the external ear canal on this side. So there is just a slight bit of asymmetry here in the overall texture of the skin of the ears. Externally, your right ear has just a little bit of flakiness, which is totally normal. It just shows a little bit of excess buildup of dead skin cells, which I can clean up for you today. So just something to keep in mind there. Alright, Samantha, I'm gonna have you just highlight that for me. I'm going to do a test for overall temperature variation. So I'm going to just test over a few different areas. Testing for any signs of abnormal temperature variety. So we like to see overall a pretty even baseline temperature in all areas. So just testing over the forehead, between the brows, both temples, down towards the temporal mandibular joint. Over the mouth tends to be just slightly warmer. Good. And coming down towards the clavicular line. Testing linear. I don't see any real variance in temperature there. Overall, your temperature is a little bit low as a whole, but I wouldn't say it's anything that I would consider abnormal. I'm getting a baseline temperature of 97.6, which is within normal limits. Just testing a few areas of the scalp to ensure we didn't miss anything concerning. That looks okay. Alright. So let's go ahead and move on. I think the next thing I want to do is perform a bit of a stethoscope auscultation. So I have my stethoscope here. I'm going to go ahead and place this in my ears, so just bear with me. Just coming here, right at the base of the hairline. I'm just going to listen. auscultating for any audible abnormalities in blood flow, any areas that could indicate any signs of occlusion, a disturbance in the circulation, which so far is not notable. Just going to listen at the temple. And coming down towards the jawline. Just going to listen here as well. Auscultating for any points of concern. So far everything sounds okay. Just going to listen on this side as well. I am hearing symmetry. I don't hear any differences really from one side or the other. That sounds good. Okay, all right. So just removing my stethoscope from my ears. Auscultation all sounded good. So we can go ahead and move on to the next part of your exam. So for the next portion of your examination, I'm going to have a bit of a closer look. So I'm just going to use my lighted tool. This is called an otoscope. Ensuring the light is working. Going to go in and have a bit of a closer look here. So come just a tad bit closer to your face, and I want to just use this to visualize the area a little bit better. So I'm just going to follow that along the length of the hairline. And then coming close into the brows and the brow bone. That does look okay. Eyelashes look very full. Again, nothing notable. This left ear does appear very clear. And just having a secondary look here. Very good. Just gonna have you turn your head just a bit so I can visualize the other ear. And I do see again some slight areas of excess dry skin. Some mild flaking. Overall, no signs of infection or irritation. So let's go ahead and move on to the more detailed portion of your examination. So I'm going to start with physical manipulation of the eyebrow, hairline, and lashes. So I'm just going to have you turn your head for me. And I'm going to begin by very gently, very gently just agitating some of these areas. Mainly directly hairline, not quite going into the skin, just right at the areas where the hair meets your forehead. Just some gentle manipulation. Looking for any signs of excess flaking, or do you see just a little flake here? We'll go ahead and see if I can remove that. Good. I think that was just a little dislodgement of some either makeup or excess dry skin. Coming on to the opposite side, right around the temporal region. And I'm going to come down to the eyebrow. Very delicate brushing of the brow. Very mild manipulation of the hairs. Just enough to agitate the skin and see if there are any signs of excess flaking or any areas of concern. Same with the other brow, just gentle brushing strokes. Looking for any areas of concern, any dislodgement of skin cells. If I start to see any irritation. So far, nothing particularly notable. And if I come and just do a brief evaluation of the lash line. Let's have a look here. Very thick at the lash line, nice and full throughout. Very even. Nothing that appears concerning there. I don't see any signs or symptoms of any mites. We do naturally have microscopic mites along the lash line as well as the eyebrows, and that is completely normal. So just going to come in and do a gentle combing inspection of the hairline. Just want to have a look and see, as well as with the brows, if there's any dislodgement or any signs of concern or abnormality here. So far as not particularly notable. Hair follicle appears to be intact, nice and strong. I don't notice any thinning or any breakage. I just kind of gently apply pressure to the follicle itself. Nice and strong, very full. Go in with my metal tool here. Now these just allow me to part kind of do a loose parting in the scalp. Visualize any areas of concern. It can be harder to perform a self-evaluation of the scalp as it's nearly impossible to visualize these areas unless you're looking in a mirror. So just looking for any dermatological concerns, whether it be moles or freckles, any concerning discoloration. Hair does appear very well groomed, nice and clean. Scalp is nice and clean. Hair textures normal for age and ethnicity. Hair color is in line there as well. No noticeable graying of the hair, which is not something I would expect to see in someone of your age unless we had premature graying. There's also no signs of age-related thinning. Overall texture of the hair is very smooth. I'm seeing just a little bit of dislodgement of flaking here as I continue to manipulate at the scalp, but overall I wouldn't say it's anything that's of particular concern. I'm going to just go ahead and do a brief measurement for symmetry at the base of the cranium. So right at the top here, kind of at the crown region, 2 inches in proximity to the hairline. Just using our ruler to measure the angle of the forehead, looking for signs of symmetry. The widow's peak that we see on the sides, and I would actually say that is slightly asymmetric, but certainly not of concern. And if we look for overall facial symmetry, we do have fairly even sectioning here at the lower, middle, and top thirds of the face. And horizontally as well, we are about even there. Clavicular lines, I would say as well, are intact. I don't see any signs of asymmetry at the collarbone. Alright. So what I'm going to do now is perform just a bit of a cleaning of that ear where I saw some of the dead skin cells, a little bit of that flaking. So I'm going to have you turn your head slightly to the left, Samantha, just so I can gain access to your right ear. So turn just gently. It's perfect there. Now you just lie in whatever position is comfortable for you. I do have access to your ear just like this. So, I'm going to do a couple different things. To start with, I'm just going to begin by cleansing the area with a simple cotton tip and some isopropyl alcohol. So, I'm just going to spray our cotton tip with alcohol and perform a mild cleaning of the external ear. Now you may feel a very cold sensation. That is normal. It shouldn't cause you any discomfort. Just starting by cleaning around the jewelry, any areas that can hold on into bacteria. As we come up the ear, going into these smaller, more flat, hard to reach places. Very gentle strokes here as the skin around your ears is very sensitive. We don't want to induce any headache or migraine symptoms. Just very gentle cleaning. I'm going to use the other side of my tool. And this side is slightly more pointy, and this will allow me to just clean any of the areas that the flatter side was unable to clean. So just again cleansing around the drawing any areas that could potentially hold bacteria. Coming up. Do tend to hold dirt or dust or dead skin cells here in this small corner of the ear. Can also be rather hard to clean efficiently. And very gently as I come down. Never inserting into the ear canal. I'm going to be very careful and mindful with Q-tube use at home. You don't want to insert anything into the ear. So I'm just coming in with a small tool. This is just going to allow me to apply a very gentle scraping motion around the ear, further dislodging any of those debris. Just irritate the skin as it's kind of a soft silicone texture, but it will just allow for very mild exfoliation. So any areas that are stuck or more stubborn, be able to scrape them off without causing you any discomfort. Being sure to access all areas of the external ear. Being sure to access all areas of the external ear. Scooping-like motions, extruding any cells that may be stuck to the surface. One of the last things I'm going to do is use this gentle suctioning tool, basically to siphon any drier debris that might be stuck on the surface of the skin. Very gentle Not applying too much pressure, simply allowing the suction of the pipette to remove any dislodged debris. Using mild output here. Very carefully removing anything you see just a little area here. All right. Going to go in with a clean cotton swab and just a little bit of some normal saline. So this is essentially sterile salt water. I'm just going to mildly saturate this cotton tip. Distribute the liquid evenly and use this as a final cleansing of the area. So you're going to feel a very cold sensation, Samantha, just cleaning the external ear one more time. The saline solution will help with any areas of irritation. Salt water is a natural astringent and cleanser. Will help remove any final bacteria that may have been transferred to the skin, ensuring no risk to the tympanic membrane, which is the innermost part of your middle ear. And again, I will just use the opposite side this time to dry up some of that excess fluid. While it is okay to use a Q-tip or cotton wool to dry and mildly cleanse the external part of your ear canal, it is important that you never insert a Q-tip into the ear itself. So, with that, Samantha, I think your skin inspection is complete today. Other than some very minor debris of your right ear, I didn't notice any abnormality. Aside from some everyday flaking and normal inconsistencies of skin texture, there was nothing notable with the eyebrows or the eyelashes. Hairline is intact and full, very healthy. And the external ear, I would say, are both within normal limits with the exception of your everyday dry skin. So, if you don't have any questions for me, I would like to see you in about the same time next year so we can perform a repeat assessment and ensure the health of your skin remains intact. Alright, so I will let you go. I hope you have a good day,